Okay, well, we'll go ahead and get started. I'm Wes Vins. I'm Health Commissioner here at Columbiana County, so welcome. I do want to start out with by recognizing some of our partners tonight. RiverWise will be videoing the entire event tonight, and then that video, Chris, here is in the back. So, Chris, thank you for that. Your volunteer work on that is greatly appreciated. It will be shared on the village website when the evening's complete. We'll get it posted so that other folks that maybe couldn't attend tonight still have the opportunity to view that. Again, I'm Wes Vins. I'm Health Commissioner here in Columbiana County, so I want to say welcome tonight. We're very fortunate to have this State of the Science event where we get to hear from some of our NIEHS funded researchers that have been investigating various aspects related to the 2023 train derailment. This work brings us some of the best academic and research universities in the world. It brings them together to address concerns that have been raised by the community. Tonight you have the opportunity also to hear about the expanded well sampling program from our staff at the Health District. I'd like to also thank, if I could, East Palestine Schools, and certainly Cody here for our IT support, and Mark McTrusty, and certainly Superintendent Mr. Rook, Dr. Rook, for his help in establishing this for us tonight and bringing it to you. We'd also like to thank the funding from NIEHS, a division of NIH at the federal level, Dr. Aubrey Miller specifically, who could not be here tonight due to the government shutdown, but we do appreciate his ongoing support and interest related to all of these projects related to East Palestine. We want to thank the research teams. These are some of the best and brightest folks we can bring to you in academia and research, and I think you're going to find some of their work very interesting. Some of it's very complicated and very advanced, but they have done a great job of bringing it to us so that we can understand it and implement it. Much of this research is ongoing, and we thank them for their dedication to the research, but we also thank them for making the trip tonight. Nearly all the research teams are here tonight, and we want to thank them for being here. I'd also like to just take a minute and thank you. Thank you, the residents of the East Palestine area, for your participation and your feedback related to this research, because that's what helps keep moving it forward. And without you, it's not possible. So thank you for your participation. And if you have any questions related to that participation, certainly you can talk to any of these researchers here tonight. The agenda that we have up in front of us kind of lays out who the speakers and which projects will be speaking and what kind of order we have tonight, but I do have a few housekeeping issues. We have restrooms that are in the lobby here where some of the tables are. I think women's to the right, men's to the left. And in the event of an emergency, we would exit the same doors that you came in, and if absolutely necessary, we could use these exits at the forward of the facility. And if you could also please put your cell phones on mute. We have a lot of material to move through tonight, and we want to make sure that we cover all that material. So if you could hold your questions to the end. We actually have some note cards that we'll be passing around that you can jot your question down on the note card. We do have a brief period at the end of the presentation, as you see here, the final segment of the presentations tonight. During that period, we'll answer questions. There'll be some discussion, but please don't feel that that's the end, because following tonight's presentation, the researchers will be available to answer your questions one-on-one, and we thank them for that. In addition to that, some of the remote presenters who may not be here in person tonight, if you do have questions and you want to learn more about some of this information, we have it on our website, the Columbiana-Health.org website. You can certainly go there to get more information, but we can also connect you directly with the researchers if your question needs answered. So I'm going to stop there, and I think I'm going to pass it off to Dr. Johnson and Dr. Gao from Texas A&M, and I'll let them get started on the first presentation. Dr. Johnson and Dr. Gao, are you online with us?
Good evening. Can you hear me okay online?
I can hear you just barely here at the podium. We'll have Cody take a look. Just a second.
So it should just be going straight out. Okay.
Testing.
Yeah, perfect. Okay. Just one moment.
All right, well, thank you so much for having me online tonight. We have a little bit of feedback, but I'll go ahead and get started. I really appreciate being part of the NIEHS R21 funded studies. I wish I could be there in person tonight, and I really appreciate your understanding as I have a teaching schedule that I could not get out of here at Texas A&M, and I'm also a mom, so I know many of you understand the busy time of activities that are happening during the school year. So I appreciate you attending, as I know there's lots going on. I'll be presenting alongside Dr. Pam Gao on our projects that are related to environmental monitoring. So on my first slide, I have a little bit of data that shows how we ended up doing sampling in East Palestine. So I'm part of a Superfund research center at Texas A&M that focuses on chemicals that are emitted following disasters. And since we had an ongoing collaboration with researchers at Carnegie Mellon, we were able to send many of our trainees to the field using the Carnegie Mellon equipment in early kind of response in February 2023. And what we detected using mobile air monitoring initially is that levels of benzene, toluene, and xylenes, which are common volatile organic compounds, which are often called VOCs, as well as vinyl chloride, which was on board the train. The levels in the air when we sampled on February 20 through 21st, 2023, were similar to what was being reported from the EPA stationary air monitoring data. What we did find, though, initially, is that levels of acrolein, which is a combustion product that has been associated with eye-watering, burning of the nose, and irritation of the lungs, was elevated compared to the background. And in some cases, as you can see on this map, up to 4 to 6 times that would be expected. And so what this prompted our team to do was to send our equipment from Texas to do some continued air monitoring. So if you go to the next slide, this shows the timeline during the remediation. So I'm sure many remember this quite well, that there was a time in early March and April where there was a heavy amount of stream aeration to try and get some of that oily sheen kind of out of Sulphur and Leslie Run. And what we were interested in was, could some of the VOCs actually become emitted into the air during this time of water remediation? So we sent our sampling van, which on board has basically a super sensitive breathalyzer that can look at very low levels of VOCs, and it can do something called non-targeted analysis, meaning that we aren't just looking at those benzene and toluene and vinyl chloride compounds, but we can look for a wide variety of VOCs. We carried out that initial sampling, and then through the R21 funding, we were able to come back and look again in 2024, which is really important to do the seasonal comparisons. Because VOCs can change over time in the environment, we wanted to look at over seasons at that same kind of temperature and humidity, what the VOC compounds may look like. So on the next slide, these are some data from the 2023 March and April sampling. What we did find with the targeted analysis, that the BTECs, the benzene, toluene, xylenes, were below risk levels, and they did continue to fall in March and in April in comparison to February. But using the non-targeted analysis, we did see some local hotspots of distinct VOCs. We made comparisons with levels in Ohioville, which we considered sort of a local rural background. So you can see here that in East Palestine, at one point, we detected a spike up to 10 times higher for the chemical compound C4H8O. And the reason we are just saying the compound there is because that is what the machine detects. It detects the mass of the VOC, and then we can follow up and look what that potential compound may be by using our chemical library. But for this specific compound, you can see spatially, it was on the map located very close to the derailment site. And when you look on the right side of this slide, you can see in March, we saw that spot elevated, and it was no longer there in April. So we can make the comparison both over space and over time. Now, we plug this into the EPA hazard comparison dashboard, or what's sometimes known as the TOPS dashboard. And you can see that this compound C4H8O represents up to potentially 6 different names. So it could be the tetrahydrofuran, could be this butyraldehyde. And so that we could make some sort of sense of that, we looked and said, what potential health risks could this compound pose? And what you can see is for the majority of what this compound could potentially be, it was highest risk for eye irritation and skin irritation. And collectively, based on other surveys, we know that this is symptoms that were frequently exhibited in the community. If you go to the next slide, you can see these are the maps of the continued sampling. Now, I know they're small, but the biggest take home that I want people to realize is that the February data is on the furthest part, close to where you can see these individual compound names. And you can see over time from February to March and April 2023, and then into 2024, during those data seasons of March and April, there were overall 16 compounds that were commonly detected in all of these data sets. Levels generally were the highest in the earliest time point in February, which makes sense because that was closest to the actual incident. So on the final slide, overall, some of the key takeaways so far is that overall VOC levels were highest in the air just after the derailment. However, there were some unique hotspots that were observed even months into remediation, and many times these compounds were known to be associated with eye and skin and respiratory irritation. We're sharing all of these data sets. That QR code will link you to our website, and looking kind of at the total sum of these ambient or outdoor volatile organic compounds. We're comparing it with the environmental data, and my co-presenter will talk about some of that next. And in the future, we'll compare with the health data that's being gathered by the other R21 teams. If you have any questions, feel free to reach out. My office phone number is at the bottom of these slides, as well as my email, and I'm happy to follow up and answer any questions. Thank you so much.
All right, thank you, Natalie. Good evening, everyone. My name is Feng Gao. I'm an assistant professor at Harvard School of Public Health. First of all, I just want to thank Wes and Aaron and Misty for organizing this. I just want to apologize that I'm not able to be in person to attend the event today because of another in-person commitment in Boston. But feel free to reach out to me or our research team anytime after my presentation if you have any question or concern regarding our results. So Natalie already presented some results based on the atmospheric environment in East Palestine. So our project will more focus on the aquatic system as well as the soil system. So we did a sampling from the local soil and sediment samples as well as the water samples, but all of them are public sites. And we in average, we collect like 25 water sample, 25 soil sample, and 25 sediment sample from East Palestine. So because of the open organic combustion that we conduct on the site, we just worry about some incomplete combustion byproduct being produced during that procedure. So we did a targeted analysis by focus on chlorinated hydrocarbons, also as well as some routine regularly monitoring environmental pollutants and see whether they present in those environmental samples and whether their concentration are elevated or can bring some health concerns. So we focus for targeted panel, we focus on the dioxins, fluorines, chlorinated fluorines, chlorinated pHs, as well as parent pHs, as well as the PCBs. And we also plan to conduct the non-targeted analysis to see if there are some other emerging or unexpected contaminants being present in the environmental sample we collected. The other major goal for our project is to do the comprehensive risk assessment based on the targeted analysis result that we have been delivered. And the model is developed by my collaborator from the University of Nevada, Reno. This is a really comprehensive risk assessment model compared with the conventional one we use because it considers different exposure pathways as well as the potential interaction within the local ecosystem, for example, like the food chain amplification, etc. So, next slide, please. So this is just the map that are showing the sampling set site we have been conduct. So I believe we were trying to balance the Ohio part as well as the Pennsylvania part. So we did half and half for all the samples. As long as the sample size have the water bodies, we will collect the water sample as well as the sediment sample on the site. But all the sites have the soil sample. Yeah. Next slide, please. So these are just some photos we took during the experiment, which we call sample preparation and chemical extraction, trying to take the organic pollutants out from the environmental matches into the organic solvents, so that we can put the organic solvent to the instrument, which we call mass spectrometry, so that the instrument can tell us what's the concentration of each targeted pollutants. Next slide, please. This is just a brief information, or we call it protocol, that we have been followed to do the chemical extraction based on the environmental sample we collected. I just want to highlight that we follow really rigorous QA/QC procedure and protocol to make sure the result we generated is validated and reliable. And I already mentioned the targeted leads, which are mostly polycyclic aromatic hydrocarbons or chlorinated hydrocarbons. And as I mentioned, we use an analytical instrument called mass spectrometry coupled with the GC, which is the gas chromatography, to analyze all these type of potential environmental pollutants. Next slide, please. Yeah, so this figure is just showing the distribution of all different type of environmental pollutants within the soil, water, and sediment samples. And their kind of relative concentration are showing as a pie chart here. So as you can see, for example, the soil sample, there are more dioxin and fluorine. However, if you see the last one, the water sample, the green portion is the dominant one, which are mostly hydrophilic contaminants, which means that they tend to be dissolved into water rather than being accumulated in sediment soil. So it does not imply anything related to potential health risk. It's just showing some, based on each contaminant's physical and chemical property, they tend to accumulate more in either water or sediment or soil samples. Next slide, please. Oops, yeah. So this is a more detailed concentration result Next one, please. Yes. Yeah, so based on the heat map showing here, you can see all the chemical we have been analyzed and their detailed concentration based on different groups. As you can see in the legend, different colors showing here. And we can see the top high concentrations one are mostly from the PCB groups, some from the PHs. But again, it does not directly imply any health risks because different pollutants, they have their different, we so-called like safe dose because the concentration of the effect are different, depends on each single chemical. However, we can see the different presentation in terms of the same chemical across different environmental metrics. And if you see the chemical panel in the middle top, there are some variation in terms of different metrics and different sample as well. Next slide, please. Yeah, so this is the box plot showing the result of all the analyzed chemical as well. And you can see based on the box plot, each one is showing the range of the concentration we have been detected of each chemical. And we can see the huge variation in terms of each chemical groups. So if we see the intra comparison, the difference are both significant, which means that there are some disproportionately distribution of all these type of chemical locally. And we are in the progress of comparing all these values with the regional screening level or some other risk assessed based concentration to see which chemical may pose elevated health risks. However, in general, we compare our result with the EPA data that they have been shared, publicly available online. We think we are in the similar range. So besides some specific outliers data points, I believe the chemicals concentration are kind of a little bit elevated compared with the normal residential sites, but it's not very high, higher than the industrial sites. Yeah. Next slide, please. So as I mentioned, we have finished the environmental sampling part, sample preparation, chemical analysis. The next step is to finish the health risk assessment by the advanced model that I mentioned. We expected to have the result by the end of this year, and after we put all the results together, we will kind of draft a report to the community. Again, thank you so much for your time, and if you have any questions, feel free to reach out us by email. Thank you.
Thank you, Dr. Johnson, Dr. Gao. Our next presenter is Dr. Aaron Haynes, University of Kentucky. Dr. Haynes.
Great, thank you so much. And I want to again thank Misty Allison and Wes Vins, Dr. Wes Vins, for enabling this group to come here. We're just so grateful to have a forum to share back information with you. So, all right, I control the slides, fabulous. So our study was called the University of Kentucky East Palestine Health Tracking Study. And we launched this project April 11th of 2023. This was the flyer that we had used to recruit and invite people to participate. And we really just spread out a wide net initially, and just like, we saw the plume, and as that was going, and just thought, everybody could have been impacted. Let's just invite anyone who lived in a surrounding county to join and give their feedback, and we can hear their story, hear their symptoms, what they're going through, and then develop the next plan so that we could address what the community is saying that we should be doing. So all of my work since the day I was born with research has been driven by community concern. I have never done a study that has never been driven by a community. So, and this is none different. This is the same as always. And this, I want to highlight that we have a marvelous, all right, marvelous community, thank you, advisory board. And Misty Allison is the chair of the board. And you can see we have a fabulous group of individuals that have given us feedback right from the beginning, informing us of what the key issues are and how do we conduct the work to make it most effective and meaningful for you, for the community, because this is your issue. I'm from the University of Kentucky. I am an Ohio resident. I lived in Adams County, Brown County, now I'm in Claremont, and these are all in southern Ohio, but Appalachian nonetheless. So this is the group that gives really strong input into what we're working on. So these are your local neighbors. So if you have ideas, please do share with them, but you can also reach the study directly by email and me by email. So I was thinking about what to share tonight. We have such limited time, and we've done quite a bit. So here's the list of the things that we've done, and the little checks means that we have a fact sheet in the back summarizing the data from that component. We have tracked health 4 times in the 2 years, the health symptoms and what you're experiencing, and we have that data in a fact sheet in the back on the table right behind those doors. We did indoor air sampling with the community because that wasn't being done. We had folks wear a silicone wristband that absorbs chemicals, and we wanted to measure what was in the wristband. So that fact sheet is back there. We also measured dioxins in blood because that was a high level of concern. But I thought I'd use my time today, because I've shared that information on our website. I'd focus on 2 things we've not yet shared. And these aren't published, no one's seen these data, but I wanted them to bring them to you first. We measured immune markers in blood, and we also looked at metabolites of the chemicals of concern in urine in a small group of individuals. So I'm going to share those 2 pieces with you tonight. All right, so on July, we did this, what we call a pilot study, where you just invite a few people, like we did. We invited 20. 19 actually were able to consented and gave a sample. But we did this in July of 23. So it's 5 months after the derailment. And we invited people who were in our survey, in our study population, that didn't smoke and lived about just a mile away, because we didn't want to measure chemicals from tobacco. We know that's there. So we didn't want that interfering. And we also wanted to look at people who perhaps could have been, most likely, exposed the heaviest. So those are who we invited. We only invited about 20. So the University of Kentucky, we have a great lab that measures immune markers. And then we sent the urine samples to Wayne State University. They were brave enough to do it because I think I'm going to talk about the immune markers first, just a little bit. But first, let me tell you what immune markers actually look like. And maybe you've heard people with asthma and allergies. You've heard maybe the word cytokines, IL-6. I don't know, if you go to the doctor and you have an allergy, they may say one of these is raised in your system. But these immune markers, there's like an interferon N dash the gamma Y. These all mean something, and they mean something to the physician who's looking at them. And so when you translate them, they turn into inflammatory cytokines. So there's an inflammatory reaction. There's growth factors, meaning there's tissue repair. Something was damaged and it's being repaired. And then the last one also has chronic inflammation and tissue repair. So it's like in the bodies of those 20 people, there was an increase in inflammation compared to a group in California. So you had to have somebody to compare it to. And the best they had in the laboratory was a group in California. So it indicated that there was this chronic low-grade inflammation and tissue repair. And inflammation, when you have that in your body, it can affect every organ, every body system. So it's of concern because it's like, okay, what's going to be impacted next? And we don't know, but that's why we're really excited to keep studying and looking further into this. So now I mentioned it to my research team. I was like, I'm going to jump into the urine now. They thought that was funny. I thought maybe I'll just say that there, because I just didn't. I was like, okay, I'm gonna jump into the urine story. So this is the urine story. We measured chemicals that were previously discussed by our colleagues, the acrolein. So I'm gonna show you these slides. I tried to make it as easy to understand as possible. So this is a metabolite of acrolein. So if you're exposed to acrolein, you don't, when you urinate and you pee, it doesn't come out as that chemical. It comes out as something different. But we know that it came from that parent chemical. It's metabolized, it's its own little thing. And the abbreviation for that metabolite is some big long word, but the abbreviation is CEMA. So that's the name of that metabolite. And we looked at the percent detected. Now, I want to say first, the percent detected means that that's the level that the laboratory's instrument could measure, could actually see it and say, yes, it's there. These levels were not high, but I just wanted to show you that what was detected, and I find this to be interesting. So in East Palestine, 19 people in their urine, all of them were detected. But in the CDC study, that's a national, United States-based population, and there's 1,000 people in there. And they also all had this. Because I'd see it with East Palestine, I'd be like, oh my, is this something important? Is this a real, should we be jumping on this? But we looked at a comparison, national levels, and they were all also 100% detected. And I will say that your levels were lower than what they were in the national, so that was good. In Marietta, so we had a comparison group. Marietta is a community I've worked with before on the ferromanganese refinery there, and we asked them to participate, and they were more than happy to. So you have friends in Marietta who are willing to give their blood and urine to compare with yours. Yeah, they're good people there. And only 92% were detected in Marietta. All right, so I'm gonna move to, there's another metabolite for acrolein, and that was called 3-HPMA. And so you can see the difference. This metabolite, it was everybody in East Palestine, but only the 19. See, we need to do it on a bigger sample, a bigger scale. But 19, it was detected in the CDC national study, 93%. And in Marietta, 92. So fairly similar. All right, I'm gonna move to the acrylates. So in the CDC, this is the acrylate, the name of it in the metabolite is BUAMA. And no, the CDC doesn't even measure this chemical. This is not something that's standard, off the shelf, everybody does it. So Wayne State, when I said they were brave, I really mean it, because they did this analysis for us, for you, to measure this in the urine. And because the CDC does not even have this in their list. Marietta, nobody had it in their system. But in East Palestine, out of the 19, 5%, which is a very low number of 19, but a few people had it detected. This is 5 months after the derailment. All right, this is the one I found most interesting, so I saved it to the end. And this is the vinyl chloride metabolite. Now, when people, I remember, and I was reading the news, and many people would go to LabCorp, right? And there was a metabolite that was measured from LabCorp. Well, we looked into that metabolite, and you could see it came from it's not just vinyl chloride, it came from many other sources. Some were even natural sources. This one, however, comes from potentially 3 chemicals: vinyl chloride, ethyl oxide, or acrylonitrile. And the abbreviation is HEMA, H-E-M-A. So in the CDC study, only 5% of the 1,000 people had it detected in their system. In Marietta, nobody had it. But in East Palestine, 74% of the 19 people had it detected in their system. So this is 5 months later. The half-life, so you have to think, and when you think about these chemicals and how fast do they metabolize, the question is, well, how long does it last in the body? In this case, it's maybe a couple days. 1 to 2 days. So that begs questions, I'm sure in your head, and it does in mine. Well, where did it come from? 5 months after the derailment and after the venom burn. Was it still in the environment? Was it potentially stored in the body and then re-released? So during this process of thinking about it, I learned, and I did not know this before, that these VOCs, volatile organic compounds, they can be stored in fat. I did not know that. So it's possible that they could have been stored and re-released. Maybe some of these individuals were all on a diet and losing fat. Who knows? Or it was still in the environment. So we have a question. I don't know. But I just found it interesting that it was there. Now again, the levels were very low, but it was still detected. Now, did we need to do this urine testing to say that there was an exposure to vinyl chloride? No, we know it was there. It was there in your air. There's no question. We all saw the visuals. But this it was just like, we need to be able to see if we can measure it in the body. If it's still there 5 months later, let's just see. And this demonstrates that it was. All right, so just for fun, I know science doesn't have fun, but we did a little fun thing. The staff, there were 4 of us, and one of the staff members lives in Rogers, and another lives in Marietta. And then, I pulled all from my team, and then 2 of us came from like the Cincinnati, Kentucky area. So we thought, hey, since we're hearing that maybe chemicals could still be in the air, why don't we collect on ourselves the day we get there, and then the day we leave? We were there about 2 days, right? So we just thought, let's just see what it looks like. So I'm just gonna show you the one that it was detected in. That we found it, and it was the same chemical here, the vinyl chloride, ethyl oxide potential, the HENA. And when we first arrived, there's only 4 of us, but half of us had it in our system. On day 2, everybody did. And I'm one of those. I'll admit I was a participant in this staff study because I was here. We were doing this component together. All right, so I just wanted to share that. And that's not been shared publicly before, but I wanted you to have it first before it went somewhere else. So key takeaways, the immune markers, it looks like there's tissue repair going on at that time. Again, this was simply in July. I don't know what's going on now. We need to do more. Chronic inflammation. And this can increase your risk for major diseases, heart disease, stroke, cancer, autoimmune disorders. And we need to measure more. I just can't repeat that enough. And in the metabolites, it's just fascinating that even 5 months later, the vinyl chloride was detected, and then the one participant had the butyl acrylate measured in their system. So I wanted to just end with that, give you the urine. I jumped into the urine and gave it to you. I found that very interesting. I think if we were to come into town and measure again, we probably wouldn't focus on that measure, but I thought it was important initially. So a reminder again, all of the other data are back there in the back. The fact sheets you could also scan here. And then, of course, this takes a team to do any work, and these are just a handful of people. And I truly need to thank the participants, because without you joining and participating and giving us your information, we wouldn't be able to pull anything together. So I really appreciate everyone's collaboration. Thank you so much.
Well, thank you, Dr. Haynes. We do have to adjust some things for our online participants.
34. Yeah, I'm not sure why I muted them. I muted us. There we go. Can you guys hear us?
Yes, now we can. Thank you.
Yeah, sorry about that.
Okay, super. Yeah, appreciate that, Cody. We've got our online folks participating again. Our next presenter, Dr. Orsina from Case Western Reserve.
Hi, folks. Not a doctor yet, but on my way. Thank you. Thank you all so much for having us, and thank you for being here. We're super grateful to be presenting. Like Wes Vince said, my name is Anthony Orsino, and I'm representing the Case Western Research Study, which we've titled the Healthy Futures Research Study. So here's our fantastic team. We've credited here, and we are led by Dr. Fred Schumacher, who is also here today, if you'd like to come chat with us after. Can everyone hear me if it's like, okay, cool. So overall, our goal in conducting this research is to reach a mutual understanding, both in the science community and with you all as residents and concerned citizens, to reach a mutual understanding of the extent of the health consequences from the derailment. Now, this is easier said than done for a couple of reasons. First of all, as the previous presenters have mentioned, this wasn't just vinyl chloride or it wasn't just butyl acrylate. It was a combination of these chemicals, and these chemicals weren't just exposures in one way. They weren't just exposures on the skin or not just exposures that were inhaled. They were exposures in many ways, potentially. And so this makes this a complex problem. Our approach to answering our research question within the complexity of this situation is to look at folks' DNA damage through blood and saliva samples. And we call that a somatic mutation rate, but that really just means a DNA damage rate. And I'll talk more about what that means later. This is an overview of what we are doing in our study. I'm going to go into each of these in more detail, but just so you can see the overall narrative of what we are doing, we're starting with creating a base of participants, building that trust, and having collaboration between us and the residents in the areas we're recruiting. Then moving on to looking at the genetic data as well as some survey data from folks. And finally, the biological aspects of this research is incredibly important, but we understand that health and well-being are something that is very holistic and not just biological. And so we are also doing some interviews to understand how this has impacted all of your lives in a more holistic sense. So this first aim, like I mentioned, is building our community of folks that are participating in our study. Our 4 counties that we are recruiting in are Columbiana and Mahoning counties in Ohio, and Lawrence and Beaver counties in Pennsylvania. So any adults or children that live in those counties are eligible to participate. And when we think about building this study base, having people participate and engage in this research, we think about doing it in a way that is community-based and community-centered, which means building this community base on trust, on reciprocity and returning the research to you all, on sensitivity, and on having mechanisms for feedback so that we can hear you and make sure that our research is answering your questions and is meaningful to you all. We do all of this so that we can generate insights that are accessible and that, again, actually mean something and help you all understand what has occurred as a result of the derailment and its potential exposures. To accomplish this goal, we have a community advisory board, just like Dr. Haynes as well. These are fantastic folks. They're kind of like our North Star. We can go to them to understand if our research approach is reflective of the community and if we have questions, and just to expand our network and make sure that everything we're doing is up to par. So what does this look like on a day-to-day? It means going into the community. We've been in the community for 2.5 years now. We've gone to the churches, we've been here multiple times, the Grange. Every year since, we've gone to county fairs, and this has been an amazing experience to chat with folks and hear their stories and connect and share what we are doing, and for people to share what they think about what we are doing. Also, a really fantastic part of going to these county fairs is that we found a lot of people in, further out from East Palestine, maybe far away in Beaver County or Lawrence. They would say, oh, this research doesn't apply to me, or I don't want to take your resources for folks who really need it. And that provided a really great opportunity for us to say, no, that's exactly what we're looking at. We want to understand how far out this impacts folks, who this impacts, and we also need people who weren't impacted to compare to the folks who were probably impacted or were more close to the derailment. So those were really excellent. We're also very grateful to have been welcomed into this community digitally. Facebook has been a great space for us to communicate with folks in an accessible way, to share our research, and thank you to the folks who have shared our research in their own networks, so thank you. Again, our community advisory board, and finally, cross-institution collaboration. We work with NIH, we work with the other fantastic people who are presenting here today. Because research fatigue is very real, we definitely don't want folks feeling like lab rats. This is a collaborative effort where we need to understand how each of our research institutions are creating this overall narrative of what happened because of the derailment. And so that collaboration opens those lines of communication and helps us understand where we are contributing. And so as a result of this principle, Case Western, we had our van here come, and a couple of our studies are collecting blood, and so we had collaboration and we were sharing blood between folks, so we weren't vampires sucking everyone's blood multiple times, just one stick. And so that was really great, and we thank our fellow researchers for working with us. And finally, we're a part of the Ohio, Pennsylvania, or East Palestine Research Consortium, and this is a group that took the government data, which was very complicated, and we used our expertise to break it down into one-pagers and ways that could easily be understood. To date, we've got over 300 participants. This map is showing our participants in dark blue are folks who have both contributed a biospecimen, so blood or saliva, and folks in light blue are folks who have just done the survey, which is amazing, and we're so grateful for them. But of course, the biospecimens are also awesome. The orange triangles represent where we've had community events, and each triangle represents multiple community events over the last 2.5 years. Moving on to our second aim, this is really where the genetics comes in and the survey data comes in. This aim is all about understanding if residents who have had exposures to the derailment chemicals have a higher DNA damage rate than folks who have had less of an exposure to the chemicals, or maybe even no exposure at all. So just for some background, everyone has some amount of DNA damage rate as they age. This is a mutation rate. It just happens naturally in the body. Everyone in the world has it. And exposures from the environment, like chemicals, can increase that rate of mutations in our bodies. And when we have a higher mutation rate, we are at a higher risk for chronic diseases like cancer or metabolic diseases. And so really what we are looking at is that pipeline between environmental exposures creating a higher somatic mutation rate, which then increases people's risk for chronic disease. That is kind of the core of the genetics part of our study. We can also look at people's survey data, so understanding their risk factors for if certain things like smoking make you more likely to have pulmonary symptoms like breathing symptoms, and I'll talk about that in a little bit as well. And we can also, like I mentioned earlier, look at how far out the extent of the impacts have been, and also look at the severity in geographic ways as well. We are hoping for over 500 adults and 100 children. We are well on our way. We are still recruiting. This is just a quick slide to show that folks who have provided a biospecimen live closer to East Palestine. So this goes back to my point earlier where folks often say, oh, I don't think this applies to me, or I don't want to take resources. But we want to have people participate from all over all of the 4 counties. So hopefully we can close this gap and have lots of people contribute both survey and biospecimen data. This slide is showing some differences between our participants who evacuated versus our participants who did not evacuate. So the main takeaway here is that we found that participants who did evacuate were statistically more likely to report new pulmonary symptoms, which means breathing symptoms. So folks who evacuated are more likely to have reported breathing symptoms that did not exist before the derailment. And then this slide also shows that folks who evacuated lived closer to the derailment, which makes sense, right? That's why they evacuated. The key takeaway from this slide is that an individual's odds of having new pulmonary symptoms, again, breathing symptoms, decreases by 11% for each mile further away from the derailment that they are. So person A, who lives here, has an 11% less odds of having new pulmonary symptoms compared to person B, who lives 1 mile closer to the derailment than them. We also found in this preliminary analysis that folks who were biologically male by sex, folks who had a pre-existing pulmonary condition before the derailment, and folks who currently smoke or previously smoked also had higher odds of reporting new pulmonary symptoms. Now, I do want to caveat this slide and the previous slide with the acknowledgement that these are very preliminary results. These are not analyses of our eventual full participant base. This is just to show you all where our minds are going and kind of the trains of thought that we're on now as well. You might be wondering where all the genetic data is, and the answer is that it's coming. It's very expensive, and it requires a lot of coordination. So we do it in big batches, and as we get more participants, we will continue this work. I want to acknowledge also that when we do have these genetic data sampled or run, we will be returning individual results to participants and linking them with resources like genetic counselors as needed. With that, there's also an acknowledgement that we are not physicians or medical practitioners. We're researchers, and so the goal in returning these individual results to you all is understanding that this is your data and it belongs to you, and that you can do with this data whatever is at your discretion. If you share it with your physicians or medical providers, that is totally up to you. It's all about getting the power to you so you can make informed decisions that are best for you. Our final aim is, again, going back to our holistic understanding of well-being. These impacts from the derailment don't exist just biologically. They've impacted how you've lived your lives, your mental health, your social systems, so many complex facets that drive your well-being and how you see your health. So to contextualize our genetic data and our survey data, we are conducting about 40 semi-structured interviews, which means just kind of like a conversation with folks to understand how their perceptions of risk have changed, to understand how their healthcare needs have changed, how their social systems have changed, all to just make sure that we are doing this right by you guys, because we know that this was not just something that happened biologically. Finally, we got approval a little while ago to include children in our study as well. We initially did not, or didn't go for this, but we included it. It's largely an extension of everything I just explained, looking at somatic mutation rate, but we're also looking at changes in development and behavior potentially as a result of the derailment as well. Now, you might be thinking that taking blood is scary enough as an adult. I know I'm very scared of it, and it's even harder for kids. And so we have these really fantastic devices that are pictured here called TASOs. We brought one here if you'd like to see it, come chat with us. And they're just little stickers that go on your shoulder and they collect just the right amount of blood for us, and totally painless, needle-free. We're gonna be using them for both adults and children, so come check it out and let us know if you'd like one mailed to you, and we could definitely do that. Finally, we are hoping to have repeated sampling of folks, so not just asking them at one time point like we currently are doing. This is a long-term thing. We are in this for the long haul. We would like to do these measurements again. And I also will acknowledge that in any future initiatives that we put forward, it will always be community-based, it will always be community-driven, and it will be guided by the needs of East Palestine residents and residents in affected areas. Thank you so much to our institution and to NIEHS for funding this work, and thank you so much to you all, to our collaborators, and to our Community Advisory Board. Thank you so much.
Well, thank you, soon-to-be Dr. Orsino. Our next presenter is Dr. Baer from University of Pittsburgh.
Thank you, Wes, and thank you, Misty, for organizing this. This is a fantastic venue, and I'm really grateful to be here. So I'm Juliane Bayer, and my co-PI on this grant is Maureen Littfeld, the Dean of Public Health. Unfortunately, she could not be here today, but yeah, I will be presenting on behalf of our team, which is actually quite extensive, as you can see here. We have several co-Is, some of them are here tonight, and we are actually like a good group of people from 4 schools at the University of Pittsburgh, public health, medicine, engineering, and rehabilitation science. Better? Good. But these are the people that we really needed and that we really couldn't do this project without. It's our community advisory board and our community-based researchers. Erica Kincaid, who was here earlier but had to leave, was the chair of our community advisory board, and many of you really helped us. We also have, as I said, these community-based researchers who actually did the work in the field. And then we had some PIT student samplers whom without we couldn't have done all those environmental sampling within the homes either. And then last but not least, the PIT community interaction. These are the people that are actually doing the health aspect of our work. So Andrila, who is here tonight, Olisa is here tonight, and Laura Dietz is here tonight as well. So we also have 3 aims. The first one is to measure chemical contaminants in indoor air and water in homes. This is really led by Carla Ng. She is here tonight, and she can answer questions to this much better, and I hope I'm not botching the fantastic data that they did. So why we do it, clearly everybody knows. What we're doing is to collect air from your basements and also water from your homes. And in addition, we also collect soil from the yard for analysis of vinyl chloride and also other chemicals that may have resulted from the disaster. In addition to that, we're also doing real-time measurements of vinyl chloride using a gas collection tube. You can see that on the lower left. So the air in the homes we are doing with these bags that you see on the far left corner, and then the real-time measurements we are doing with those collection tubes. And I'm pointing that out because on the next slide I'm getting more into detail about that. And in total, we wanted to recruit around 100 homes, recruit and train 5 community-based researchers to help us with this, and then recruit 7 homes for outdoor air passive sampling for 1 month. So, and here are our preliminary studies, or our preliminary study progress. So we did, in fact, recruit 6 community-based researchers that worked with us and did a fantastic job, and thank you very much. Again, we couldn't have done it without you. Homes that were sampled for water, soil, and indoor air are 90. Passive air samplers were installed. There are 7, as was our goal, and they are staying in place for a month. And so we have so far analyzed the indoor air samples, and the results to the participants will be sent out soon. These data are literally hot off the press. We got them, I think, yesterday, 2 days ago. And that's what you see on the right. And so what you see is there are different VOCs, and first and foremost, the one in the dark blue is vinyl chloride. And what you can see if you look at those dotted lines is that they are below the acute level for short-term exposure that are considered, or the guidance by EPA. However, they are above the chronic levels for long-term exposure. So we have to say here that we will need to do some further testing. So these samples were measured in these bags that I pointed out earlier. But we also at the same time measured these real-time air samples in those collection tubes, and they showed no detectable levels. However, the first 4, or the top 4, so the bags are a lot more sensitive, or the measurements that comes from the bag is a lot more sensitive than what we have in those gas collection tubes. However, the top 4 of those dots that you see in the bar graph, those should have been detected in those gas collection tubes, and they were not. So what we're planning on doing is going back with some other methods. These are called Summa canisters. There are even more, or the air that is being collected in those is going to be even more. It's going to be more sensitive than these bags, and we're going back to about 6 or 7 homes, doing the canisters and the bags at the same time. And if we get the same results in the bags and in the canisters, we can really say that we can rely on on these data from the bags. And again, Dr. Ng is here, and she can answer questions to that a lot more reliable to me, than me, because I'm more on the health aspect of this study. And that leads us into the health aspects of the study. Why we're doing it, again, you guys know clearly. And so the reason why I was interested in this, I'm a liver researcher, and there are several stages of liver disease, as you can see in the scheme. It starts with just accumulation of simple fat in the liver. You've probably heard of the term fatty liver. And then over time, there's an inflammatory component, and then over time, there's even some scarring, because the liver breaks down the chemicals that you're exposed to get rid of it. But in doing so, it takes one for the team and may actually get injured in the process, because these are toxic chemicals. And the liver is usually good about, recovering. However, if this continues to happen because there are chemicals in the area, this may get worse. So how we're doing is collecting blood and urine. In the blood, we are measuring biomarkers for liver damage, and in the urine, we will measure chemicals or chemical breakdown products. And then a thing that we didn't plan on originally, but we got the opportunity, UPMC has this mobile unit called a FibroScan. That's what you see in the lower right corner. It's a non-invasive ultrasound-based technique to measure liver stiffness. So you can imagine if you have fat in the liver, it's just like if you have fat in your abdomen because you're overweight, it's stiffer because there's just more, resistance. And then over time, if you have more injury and there's scarring in the liver, certainly you can imagine that that's a lot more stiff too. And so this machine can actually measure it. And as I said, it's non-invasive and takes only 5 to 7 minutes. And so our goal was to recruit 300 participants, and we are well on our way, but again, like the last study, we're still recruiting as well. So this is our preliminary study progress. We have collected blood, urine, and health data from about 110, from 110 residents of East Palestine and the surrounding areas. We have measured liver enzymes, so those biomarkers for liver disease, in about 79 of them. And all the other ones are currently in a UPMC lab, and we'll get the data back on Friday. We have administered about 36 FibroScans, and all the individual results that we have in hand today have been mailed out, and all the residents should have gotten them. If not, then they are maybe still in the mail. And the way that looks is what you can see on the right-hand side. That's it's the letter for the study participants. And don't worry, this is no single study participant. This is just the cover sheet. There are 2 pages to it. On the second page will be your study results. And on the first page is just explaining what we're doing, of course, thanking you for all that you do to help us with this. And then showing you the ranges of what would be normal or what would be abnormal. And then again, you can compare that to what you see on the second page for your own liver levels. And we're doing this for FibroScan and for blood samples, two separate letters. And then we're also explaining on what this means, and we're explaining a little more about what liver disease means and what your results may mean. And then the last paragraph, we're just, again, like in the last study, we are PhD researchers, but I'm in a UPMC department, so I'm working in the liver center, and I can refer, with this letter, we will refer you to those physicians there that can help with that. What I forgot to say, we have been collecting all of our blood samples here in East Palestine at the East Palestine Clinic that has moved now to the East Liverpool City Hospital, and that we're using now going forward, starting this week, actually. And again, all the measurements were done at UPMC. Last but not least, AIM 3. One of the things that came up early, and we didn't initially proposed this, but all the parents said, what about our children? So we are asking parents about their children's health and development. We are including the parents of children between the ages 0 and 18 to answer questions about their concerns for their children and in health and development. And the plan is to recruit 100 parents within a 10-mile radius. 10-mile radius is our overall goal for all of the aims. And we're including Columbiana County and Beaver County. So far what we have, and this study, or this part of the study is led by Dr. Dietz. She, I think, is also here today. I haven't seen her personally yet. Oh, there she is, okay. She can also answer questions. So we have so far 30 parents, 12 from Ohio, 18 from Pennsylvania, 49 children, 16 from Ohio, and 33 from Pennsylvania, and the mean age of the children is about 9. So 90% of the parents that were surveyed were absolutely agreeing with that they are having anxiety about their children's health, and 63% of those parents expressed a lot or a whole lot of anxiety about their children's potential to exposure to toxic chemicals. So that means that's 30 parents of the ones that we have so far. Is this still working? All right, can you hear me good? Okay. So 45% of the children, so 49 children, have experienced, I don't know why this is capitalized, nasal drainage. I didn't mean to do that. Congestion and frequent infections post-derailment. And 37.5% of the children of the 49 have experienced respiratory issues and breathing problems. And 45% of the children have experienced mood problems, including sadness, irritability, and anger. And these are significant numbers, clearly. So with that, I want to thank everybody again. This is the PID team, the Community Advisory Board, and the community-based research. Thank you for everyone for being involved, and again, we couldn't have done it without you guys.
And let me add my thanks to everybody.
Okay, you're up, Dr. Golem from University of California, San Diego.
Hi, thanks for I was having some communication with this, so Jessica was pre-prepared a presentation today for her to play, but while I'm here, I'll just mention that we kept it under 11 minutes to have time for Q&A, and I also want to echo what other researchers have said. We take adults and children, and all results are given back to participants. Thanks, Jessica. Hi, I'm Dr. Dietrich Salon, and I'm here to talk to you about our recent San Diego East Palestine Health study. Next slide. The concept is that perhaps we can learn from gulfing illness, a condition that arises after very different mixed toxic chemical exposure. In gulfing illness, parents develop the same symptom profile despite widely different chemical mixtures. The severity of gulfing illness. Can I just interrupt and ask? I'm having trouble hearing. Are other people having trouble hearing? Yeah? Should I just go ahead and give this talk myself? Would that be easier? Is there a sound problem? I'm hearing echo back when I talk.
Yeah, just a minute.
I think it's their microphone. Yeah, we can do that. Okay, try that.
Okay, I'll just go ahead and give the presentation. So again, I'm Dr. Bishop Gone here to talk to you about our UC San Diego East Palestine Health Study. Next slide. The concept is that perhaps you can learn from veterans with gulfware illness, a condition that arose after a very different mixed toxic chemical exposure. In gulfware illness, veterans develop the same symptom profile despite widely different chemical mixtures. And severity of gulfware illness was found by us to relate to severity of mitochondrial impairment, irrespective of the exposure mix. Mitochondria are the energy powerhouses of cells, and this makes sense because most chemicals impair mitochondria as part of their toxicity profile, including most of the EP chemicals. So this mechanism can add and synergize across chemicals to surpass clinical toxicity thresholds, even if each individual agent is within safe limits. Because of this, we hypothesized that a similar clinical profile and similar objective markers would be seen in East Palestine as we saw in the Gulf War. The data that we'll see are from initial cross-sectional data of those within 20 miles, half were within 1.2 miles, so a pretty exposed and affected rate. Next slide. So the chronic multi-symptom illness that arose in some of those exposed to the EP derailment is a match to gulfware illness, based on the so-called CANSAS criteria, which are now enshrined in a diagnostic code accepted by the CDC just this month for gulfware illness. These CANSAS criteria require persistent symptoms for at least 6 months that have to be at least moderate in severity in at least 3 of the listed 6 domains. 73% of our East Palestine participants, who clearly were self-selected for being close and affected, met these CANSAS symptom criteria for gulfware illness. So when those exposed to the derailment develop persistent health problems, it's a match to gulfware illness. Next slide. So the top most common symptoms are also a match. To look at this, we use the UCSD-20 validated gulfware illness symptom severity scale, which selected 20 symptoms because each of these had been present in the prior 2 weeks in 50% or more of a sample of veterans with gulfware illness. So if this is a similar profile, we would expect similar top symptoms. We would expect that most of these would have been present in some number in striking distance of 50% in the prior 2 weeks in our East Palestine sample. And indeed, 19 of the 20 symptoms in our East Palestine folks that met these similar gulfware illness criteria were noted in 45% or more of the sample. The only exception was tinnitus or ringing ears, which had been present in 35%. But it's known that chemicals enhance noise-induced auditory injuries, and veterans have more noise exposure to things like artillery fire and jet takeoff. So the 50% threshold in the Gulf War veterans for ringing ears is likely achieved from a combination of chemicals and noise. In short, the top symptoms are also a match to Gulf War illness, and we use this UCC-20 severity scale also as a severity scale for this persistent multi-symptom illness in East Palestine. So next slide, I'll just briefly mention that stress and anxiety are an important feature also in Gulf War illness, and they were emphasized early on as a possible cause, but ultimately evidence showed that they were no independent contribution, that a lot of it is shared consequence. Energy impairment promotes anxiety and stress, and indeed there's evidence that treatments that address cell energy, improve cell energy, reduce symptoms, even symptoms ascribed to PTSD. There's plenty of cause for stress in East Palestine, and anxiety is a big issue, but it's not the cause of the other problems, assuming they're not the same as Gulf War illness. Next slide. The top abnormal routine lab was also found to be a match to Gulf War illness. So the main clinical measure of inflammation is called HSCRP, or high sensitivity C-reactive protein. The name isn't important, but it's the most commonly abnormal lab in Gulf War illness, and we found that it was the most commonly abnormal lab in our East Palestine sample. It's nonetheless a minority of affected veterans in which it's frankly elevated, and it was a minority, 31% in our East Palestine sample, quite a lot that had abnormal values, but still fewer than half. Counterintuitively, in Gulf War veterans, the higher the inflammation, the less severe the illness. The same counterintuitive finding was present in East Palestine. The higher this inflammation marker, the less severe the illness. And we showed here the results of what's called a regression analysis, which is a statistical method at looking how a predictor relates to an outcome. And we're predicting the severity scale, USD20, that is inflammation measure, HSCRP. The minus 5.3 means that for each additional point at HSCRP, the expected USD20 score is lower by 5.3 points. Well, USD20 goes from 0 to 200, it rates 20 symptoms each from 0 to 10, and the average value, both in Gulf War veterans and in our East Palestine veterans with Gulf War illness and our affected East Palestine sample, was around 90. Minus 5.3 means if you had an HSCRP value of 10, which several in our East Palestine sample had values of 10 or greater, then 10 times minus 5.3, or 53 points lower expected severity score would be present. With a mean score of around 90, this is quite a high impact, and the p-value on the far right of 0.007 means that there's a probability of 7 in 1,000 that chance could be responsible for this finding. Very unlikely that chance is responsible, and this is considered to be highly statistically significant. Next slide. So the East Palestine post-derailment illness, like Gulf War illness, is tied to altered membranes. In Gulf War veterans, we were able to do skin biopsies and look at membranes under microscopes and do other tests. So we didn't have the funding for that here, but we could send cells off for membrane fatty acid composition, which is typically tied to these other kinds of membrane changes. And sure enough, there were 2 membrane fatty acids that were powerfully tied to severity of this post-derailment Gulf War illness type chronic multi-symptom health problem. And both of these fatty acids are considered markers of metabolism, how the body processes chemicals, not a diet. So what you see here are what are called scatter plots. Each point corresponds to a person from the East Palestine region that gave both blood for the fatty acid and completed a survey so that we could calculate their USD20 score. So the first one looks at EDA, icosapentaenoic acid, and going from left to right on the x-axis goes from lower higher values of EDA, and going from bottom to top on the y-axis is more severe illness. So you see that as EDA gets higher, going from left to right, illness gets greater, going from low to high. So this fatty acid is tied to higher illness severity very powerfully, with a probability of less than a 1 in 1,000 chance could be responsible. Similarly, on the next scatter plot, going from left to right, a different fatty acid called nirvanic acid is greater. The greater nirvanic acid is the less severely illness. This is also highly significant. Nirvanic acid is known to be tied to nerve cell communication. EDA is a little studied minor membrane component, but the one human condition it's been tied to is a condition based on mitochondrial impairment, the same foundation we found for Gulf War illness, and we believe is present in our East Palestine sample. Next slide. So to recap and also sneak in a few additional findings we didn't have time to present, illness, the persistent multi-system illness that some develop following derailment is a mirror of that in Gulf War illness, suggesting that lessons from Gulf War illness can be used to jumpstart our understanding of persistent health problems in East Palestine. The chronic multi-symptom illness in East Palestine meets the same symptom diagnostic criteria as for Gulf War illness. The top symptoms are a match. The top abnormal routine lab is a match. This lab, HSCRP, bears the same counterintuitive relationship to less severe illness in EP that it bore in Gulf War illness. Inflammation, and these are data we didn't show, is tied to drivers of cell death in both conditions. Membrane alterations are tied to illness in both, and also not shown. The conditions being reported in apparent excess in East Palestine are matched to conditions that have been documented to be significantly elevated in Gulf War illness. Sleep apnea is elevated in Gulf War illness and contributes to health problems, and our data suggests that the same is true in East Palestine. Chemicals magnify the risk of sleep apnea. A number of distinctive health conditions reported on social media in East Palestine were also reported in Gulf War illness and often shown to be significantly elevated, including need for gallbladder surgery, seizures, and breaking teeth. Next slide. The implications are that we should surveil for conditions that were shown to be elevated in veterans with Gulf War illness because these may likely emerge as elevated here. Also, not from data we haven't shown, we should seek to curb reversible risk factors, even things like smoking and alcohol that people think of as death anyway. Even with very low levels of smoking and alcohol, we found we're taking significantly worse illness, analogous to illness. Both of these worsen cell energy by their own mechanisms, and both affect chemical detoxification, inducing a detoxification or toxification enzyme called CYP2E1 that actually converts vinyl chloride to a more toxic intermediate. And by the way, this takes place in mitochondria and in the process produces free radicals that increases mitochondrial impairment. We should test for mediating conditions like sleep apnea that can magnify the symptoms and health problems that emanate following chemical exposure. And we should consider testing treatments that have shown promise in Gulf War veterans, and indeed we're ramping up right now to initiate a trial of coenzyme Q10, which we previously found significantly reduced symptoms and improved objective physical function in Gulf War veterans. Final slide. My profound thanks first to the NIEHS, to whom we're deeply grateful for funding this work, to the other R21 recipients. It's been an honor to get to know you and learn about your work, and most of all, our sincere and deep gratitude to those in and around East Palestine that were kind enough to participate in this work, and also to individually reach out and share their experiences. Thank you so much. And we'll be delighted to hear from any of you and answer any questions.
Okay.
Is there any ability to get questions?
Dr. Golub, we'll go to questions after this final presentation.
Okay.
Thank you. Our final presentation, Laura Faust, Director Laura Faust from, let's see, am I on here, Cody? There, is that better? Get it?
There you go.
Okay. Everybody hear me okay? All right, super. Our final presentation, Laura Faust, Director Laura Faust from the Health District. Thank you, Laura.
I would have been fine with the microphone off. No. I'm the Environmental Director at Columbiana County Health District. I'm really excited to see how many people are here today. It's a great turnout, so thank you for coming and spending your evening with us. I'd like to talk a little bit about the expanded potable water sampling program. And to do that, what I need to do is explain what we've been doing briefly. It's been a few years that we've been sampling in the priority zones. We haven't really been talking about it a lot, but it has still been ongoing. And we started sampling in those priority zones in February of 2023. You've probably seen this map or some version of this map sometime in the past. You can see the little red rectangle in the top kind of right portion is where the train derailed. And we have the 4 priority zones located here. The first one is I believe it's blue rectangle that goes right around the village of East Palestine. The second one is the boot shape that heads down the creek to Negley. The third one is the yellow circle, which is the 1 mile radius around the derailment site. And then the fourth one, you can just see the beginning of going off of the slide to the south is a 250-foot setback off of the creek that goes all the way to the Ohio River.
We're actually not sharing screen with the Teams meeting. Can I make an adjustment?
Sure.
I apologize.
Okay, so these are the existing priority zones. As I stated, we've been sampling in this area since February 23. We've taken co-located samples with a contractor from Norfolk Southern, over 1,900 samples so far. All of those results have been placed on our website, sent to the resident. We've not found any exceedances related to the derailment to date, and that sampling is ongoing. So in this time period, we were not able to offer sampling services to residents outside of the priority zones. There was no funding for that. There was no staff for that. We were just simply unable to do it. That left a pretty big gap in people that were located in the area but didn't have the funding to be able to have their own sample taken because it'd be pretty costly. So we're really proud to finally be able to announce that we did receive grant funding to do sampling outside of the priority zones. So that funding was awarded this year, and it's going to provide sampling services and also educational services for residents about groundwater and water wells. So this extended sampling program is going to mirror the same program that we have been doing inside the priority zones. Sampling currently for the 29 chemicals of concern. If you remember at the beginning of all of our sampling, we actually were sampling for 186 different chemicals. That's been pared down to these 29 chemicals of concern, and residents outside of the zones will have these samples taken in their water. So if you live in Columbiana County and you have a private water well, you can apply to have your water sample. We actually have some applications out front at the table. We have the application on our website. You can always call in, stop in the office and pick it up. This is a reverse of the first map that I showed that shows the area where people are able to get their water sampled. And if you're in the priority zone and you maybe got your water sampled once but haven't had it resampled, like I said, we're still sampling in that area, so you're welcome to call in and get back in the rotation of sampling. So pretty much anyone in Columbiana County could qualify for sampling in one manner or another. This expanded sampling will be ongoing through 2031, and the application period will open annually for that. So we're right now in the application period. You can see this timetable of what we're expecting to do. The application period ends the end of October. We're going to review all of those, and we have enough funding to be able to take 100 samples this year. So if we have more than 100 samples, we'll have to screen those looking at different factors like location, health issues if you've been sampled in the past. And you're always welcome to apply next year when the application period opens again if we're unable to sample you this year. We're expected to start sampling in November, and we'll be contacting residents that are approved to get their sample done. We'll set up an appointment to come out to your property, be there about an hour to run water to take the sample, and then typically it takes about 3 weeks to get those water results back. We'll be sending those results back directly to the homeowner. We'll also be de-identifying them and posting them on our website, similar, again, to what we've been doing with the original program. So when we get the results back, luckily we have partners at the state and federal level that can help us if we find anything in the water. They can give us some information and recommendations that we can provide to you on what that means if we find anything. We also can provide assistance reviewing lab results. We developed this document that's pictured here in April of 23 because we realized when we're sending these lab results to the resident, even though we were calling them and sending a letter explaining it, it's still really hard to read the report, and we know you want to know what the report says. So hopefully this document was helpful. I had to learn how to read the lab results right along with you, so you are not alone in that. So we're hoping to be able to review all these lab reports just like we have been in the past with residents that might have questions about them. Finally, I mentioned education. We've contracted with Tetra Tech to offer education to residents, and that will be ongoing again until 2031. A variety of different topics, including things we might find throughout the process of sampling, information about groundwater, aquifers, how water wells work or function, and we also would like feedback from the community on other topics that might interest you that we can provide education on. So I was trying to be brief because I know we need to get through the Q&A, but we'll be here at the table if you have any questions, if you'd like to apply, and email and phone number there. Thank you.
Okay, thank you, Laura. We're going to, I think, move into the next phase here, which is really the discussion. And The questions. Dr. Haynes from University of Kentucky has volunteered to lead us through that. So if you would, Dr. Haynes.
Yeah, you don't mind coming down here, maybe. Mike, is that portable? Should I take it now?
Yeah, sure.
Enough of the stage. Great. Great, so we passed out cards. If you got one and you were encouraged to write down a question, do we have cards? If you have one, do you want to wave it out? I think you had a little runner, sweet little girl picking them up. Did anyone have a card down? All right. So if they weren't written down, great. Are there questions from the audience? Something that you'd like clarification on? Any of the, you got a lot of information tonight. I think it's a lot to digest. Yes, Jamie.
So I think when the funding was first
You need a
awarded,
mic.
oh, I'm so loud, I can't even. Just for clarification, that when this funding was first awarded, I think I remember it was a 2-year or a 2.5 year, and everybody keeps saying what they're doing more and how they're getting more participants. So what is the timeline on these research studies?
So we are funded, you always have to remind me, I believe until the end of December? The end of December, and this funding ends. Now, the NIH works that if there's any funding left over that we haven't spent, we can ask that it be carried forward. It would be carried forward into the next year. And then we have to propose a budget and see how we're going to spend it and by when. But the funding ends for these projects in December, end of December. Yes, Jessica.
My question is for Laura.
Hi. Okay.
On your slide, you mentioned that there was no exceedance found related to the derailment. So I'm curious how that was determined, whether it was related or not related, and also exceedance of what?
Yeah, so what I was speaking of are the samples within the priority zones that we've been co-sampling with the contractor, Norfolk Southern. So off the top of my head, there were 4 exceedances that our department found during the sampling. And we have investigated those, resampled, and found, again, not related to derailment. The first one, which was the most exciting because it was the first, was a disinfectant byproduct. So we found out that the resident had chlorinated their well before we came, and there was disinfectant still in the water. The second one was called dinitrotoluene. We resampled that and were unable to find it in the water again and have not found it again since. The third, we've seen several times at a commercial business, and it's toluene. When we sample inside the business, there's toluene in the water. When we sample outside, the spigot outside, there is none. So we assume that that's related to the chemicals in the business. The fourth one is my favorite, and it's naphthalene. And I've given this presentation several times, and one of them was an industrial hygiene conference, and they just blew my mind because I said, does everybody know that there are people that use mothballs to deter snakes? And everybody was like, yes. We're like, this took us a really long time to figure out what was going on. So there's one house in particular that every time we sample in the basement, there's naphthalene in the water, and it's actually because of the mothballs. So we sampled outside once, there was no naphthalene. Those are the 4 that I can remember exceedances. Now I can't speak for Norfolk Southern because they have their own separate samples, but as far as our results, so those were the investigations and what we found.
Laura, I want to piggyback on that question. Get ready. My question kind of goes along with hers as well too. Our well on By Road was tested right after the derailment, and our chemical exceedant was bis 2 ethyl hexylphthalates. And when I think I might have spoke to you actually, and we were told to evacuate, so we went to a hotel, and I then had all of those results. I got in touch with the railroad. At that point, they were still in New Watford at the church, and they brought in a scientist to speak with me as well. And it was very confusing to figure out what was going on. So we evacuated for about a month. But now we're not being tested for bis-2 ethylhexylphthalate, and I would like to know why we're not being tested for that, because we did test positive for that right after the derailment.
So that one I had to learn to say because I'm not a chemist, but we had several detections, no exceedances that I know of, at least in our samples of this too. And what I was told is that's actually a common laboratory contaminant. And so we were seeing that over and over again. Why it was removed from the chemicals of concern, I can't speak of that. That's something that happened through the US EPA and that whole process. So they developed the chemicals of concern and pared those down from the original, I think it was 186 chemicals, down to now the 28, 29 that I showed on the slide.
I'm sure everybody knows Scott Smith as well. He has been testing, and his results have detected very high levels of bis-2 ethylhexylphthalate. So I am concerned for my children, for my family, with the private well. We still live in that home. I don't know what to do, but independent, scientists have been picking up very, very, very high levels of that same chemical. So I guess I would hope that you guys at the county would then take a look at that as well too and see if we can still be testing for that, because that should probably still be on the list of chemicals to test for.
Thank you for the comment. Does any of the R21s want to respond to water and this particular chemical? Any thoughts? Okay, give a hand.
Yeah. So my question is more about like the collaboration components. We have all these different researchers that are doing very similar things. They're looking at blood, urine, whatnot. And I know there's talk about collaboration, but I'm just curious, like, has there been an effort from the researchers as a whole, you guys are all like R21 recipients, to say, here are the people who have signed up to do our research, here's their information, and asking the people who are willing to participate to share their information? Because truly, it's really hard, like, I hear about one study, but not another study, and then I hear that these people are here, but I didn't hear about it, and I'm very active in the community and not hearing this stuff. So I would hope, I guess it's more of a comment too, that just moving forward, anybody who receives funding in the future really does work together. Ask, your participants if they could be on a list to be contacted by, it could be like the R21 researchers or whatever. But if people are participating, it's because they want answers. And so if you're not reaching all of us or the people who are willing to participate, I feel like a lot of these are happening in isolation, if that makes sense. So if you could disseminate our information, that would be great.
Yeah, I don't want to speak for the R21 group, but just in general, personal identifying information is always very sensitive. Absolutely. And so pushing that out and we're very respectful of that with the groundwater sampling. So that's for us, for me, your privacy is very, very important. However, any of the research projects that may be out there in the community, you can find all of those on our website.
But could you guys work together to make an ROI that says that you could release our information to these entities? I mean, who are participating.
Yeah, again, I would refer to that. The R21 have to work together. But all the research projects that are out there, you can go to our website and you can look about on each of the research projects, and it'll tell you about what they are and what the information is and how to contact. We did those one-page summaries, which I think are really, really helpful. So I'll let you speak to them.
No, but that's an excellent question. And even knowing that, so when the government funds research, individual to institutions, and there was no requirement that we even work together as much as we did. But we knew it was important for your sake that we get together. I mean, institutions are competitive. But it was critical because this is not for us, it was for you. So how can we work together? And there were many steps taken to collaborate with, you heard about the harmony in the blood collection and lessening the blood draws. Excellent. Could we have done more in terms of sharing participant information? Yes, but that's tricky when it comes to confidentiality. I can't share mine with anyone. Pittsburgh can't share. They can share. But we did try to let people know if you were in a study and there was something going on, like, okay, FYI, events are occurring. Now for new funding coming forward, There is a collaborative with University of Pittsburgh, Kentucky, and Yale is there. So, and that's their way NIH funded that was that we had to work together. We have to. So it will be more harmonized than these were. Question? Yeah.
Will there be another conference before like this first round of funding runs out? Like a similar conference like this in December possibly?
Yes. So for right now the teams are building, figuring out kind of what to do, and there will be a rollout. There will even be a community meeting. It was intended for late fall. Even the NIEHS staff want to come and others from the government agencies, but with the shutdown currently, they can't make travel. So we're kind of on hold on when they can come. But as soon as they are ready to travel, the teams are planning to convene, meet with residents, and really create an agenda, not just to share what the research is going to be, that's important, but also to hear from the community what it should be and what we want to expect it to be, because it really needs to be community driven. So yes, I don't know when because they're currently in shutdown. And another topic.
This is following up, so I'm currently at the University of Pittsburgh. Just following up from an earlier question about when we got this funding, it was for 2 years, right? And not every project that reported today is carrying forward and what's going to be this new incarnation of what's going to be happening. So with respect to the fact that we're still talking about what we're going to do, for example, our team who did a lot of the in-home sampling, we collected all the samples we're going to collect, but there's still a lot of analysis to do. So even though our funding ends in December, the data is not all going to be completed, the story is not going to be fully told yet. And so even if it's not at the end of this year when the projects end, once we have all of the data put together, I think we probably will do another event and kind of close the loop on these projects as well.
That's true. And I'm going to go back to you. Even though our funding date ends at the end of December, I know we still have some data that's not out there yet that we've collected. So it doesn't mean it stops. We continue on until it's published and brought back. So we should have another forum perhaps just on the R21s in a year or so, just to make sure everything's been shown. Great.
So I don't know who I'm addressing this to, but I've had 5 independent testers, including the US EPA, come and test my soil. So it is contaminated. Vinyl chloride after time breaks down into formaldehyde. 8 months after the train derailment, they were finding formaldehyde in the very tippy tops of my soil. My grass doesn't grow in certain areas. I've had my home insurance test the inside of the house, and it's also 4 is complete restoration. Mine was at a 3.8. I guess what my question is can I have my home tested or the soil tested by you guys? I don't think any universities have come out. And so if you find things, what is the remedy for it? Yeah, it's there, so what?
So I'll ask anyone who collected soil in their R21 if they're, yes, Ms. Burke?
So, yeah.
So we did collect house soil as part of our study. I don't think you were in our study because you said that the universities had gone through. So if you're not, we have not analyzed the soil yet. We're definitely done with the air data because we're doing the data analysis right now. But come talk to me afterwards. We'll talk about it.
You haven't gone in, then we'll check for that.
Thank you. My name is Wendy. I'm from Beaver County, and I have, I guess, a comment and a question. A comment to echo the woman in the
I'm a functional general practitioner, and I don't know about these studies in Beaver County. It's so many people in Beaver County are lost. So I don't know. My question/comment is: are there any initiatives to pull more people from Beaver County? And if so, are you taking into consideration the chronic leaks and things from benzene that we're dealing with from the Shell plant there?
Sorry. I keep raising my hand, but I just,
I just wanted to mention that aside from the East Palestine work, where we have done some sampling around Beaver County as well, there are specific studies happening right now in Beaver County that are specific to the cracking plant. So if you don't know about those, I can talk to you afterwards as well.
So during the presentation tonight, we heard that was it 74% of people in East Palestine tested positive for the vinyl chloride metabolite. 74% of the 19. Sorry. Okay, thank you. And then just after a few days, all of the researchers tested positive. I saw on a slide, I think it was Dr. Gow's slide, a Protex predicted 3 years of vinyl chloride exposure post-derailment, but I'm curious, how long is this going to be here in our community that we're going to be exposed to this at low levels? We're looking at some documents, from the port that's suggesting the soil was contaminated for at least 23 months. What does that look like from a researcher's perspective when you have this spill? How long are we going to be exposed to this?
Is Dr. Gao still on the line?
Yes.
Did you hear the question? It was related to your temporal exposure modeling. About how long?
Yeah, I heard the question. Yeah, so based on model results, I think vinyl chloride impact will be pretty short. About like half of the year it will be gone because, as you know, the vinyl chloride have a relative short half-life in the environment. So that's the reason our research is more focused on the persistent pollutants, as I introduced, which are derived from the incomplete combustion. And we found that the results are kind of consistent with the EPA reporting. Definitely, we had some health risks, but we didn't analyze the result from our model yet, based on the incomplete combustion by results. I hope that address your question. Another thing I want to mention is that when we look at the environmental monitoring result, we need to take a look at the sampling date, because I know that EPA have been conducting multiple round remediation, which I think is helpful to decrease the level of certain chemicals. So, if we compare the result that are not collected in the similar time frame, it will not be reliable to reflect the current concentration. Yep.
Did I hear you say 6 months? Did you mean from now or when the derailment occurred?
Sorry, I didn't hear you.
Sorry. So you mentioned 6 months. To Jessica's question, she asked about the vinyl chloride, how long it would be, and I thought I heard you just now say 6 months. And I wanted just to clarify, did you mean from today or from when the derailment occurred?
It's from the derailment, the release setting.
Can I ask you that? Yes. You're a vinyl chloride expert.
Thank you. Well, I'm not a chemist, but so the thing in the open air on surfaces, vinyl chloride, gets degraded relatively quickly. However, it can persist in the groundwater where there's no air and no sunlight. So, I mean, that's the concern that came to us rather quickly, because it can come out of the groundwater. If your house sits on a relatively low aquifer, it can come out, especially if the house is warm.
the temperatures are warm in general. And then the thing that we Americans do is we don't open our windows often enough, so airing out would be helping. So the thing is that it can collect within the homes, and this is why we are testing the indoor air. And this is potentially why we are seeing still vinyl chloride around after over 2.5 years.
But is there any view predicted that it would be around?
Do we predict that it will be around?
How long?
We don't know. It can persist in groundwater for years.
Good questions. Did you have one? Do you want to maybe? Yeah. Do you want to mic this time?
Yeah, so just to provide, I guess, some like orientation stuff. You said that 2 research came here already with things in their blood. So obviously we're being exposed to these things in the background all over. You said the CDC study from all over the United States had positive results. So I guess, can you give us context to, we know that we're exposed to some of the things, like you mentioned the cracker plant, like Beaver County, is filled with power plants and things like that. We're in the Rust Belt. How much of this is common that we see just in the area we live in Pittsburgh area versus do we think is directly related to the chemicals of the train? Because I think that's an important contextual question. Like if this is, and are we taking a sample, are you guys looking at samples? You mentioned people, a community in California. I understand that's the sample you had available or one of the studies did. But are they similar in nature to these communities? Like the Youngstown area, we've been exposed to industrial waste for decades. So are we comparing these samples to like communities with like the same exposures apart from a trade group?
Well, you're hitting on a very good scientific point, which is a comparison. Who do you compare the data to? And in many cases, we compare to national values, like the CDC said, 1,000 people. That's a fairly good comparison. In the future, the plan is to recruit people from a similar community, rural, Appalachian, Ohio primarily, and then that's going to be in Guernsey County, Cambridge, Ohio. They're your comparison. And we're going to build that as a group so that all the data collected here would have a suitable comparison. If there's national values and data available, that's where we would go, because that's a bigger group. Otherwise, it would be rural Ohio, Appalachia.
In an industrial site as well, so we have a
well, they, Cambridge, they have, when you look at where they are, they've got crisscross the highways, there's fracking, there's injection wells.
There's power plants.
There's
plenty of industrial.
Very similar.
Yes, it's very similar to most communities.
Yep.
I'm from Cambridge. So, so it's a very similar community.
Yes, and I wish there was a pure county, Columbia clean. Unfortunately, we all live in, some are just less, more industrial than others. But you also brought up a point, maybe you've heard the term legacy exposure, right? What was here before the derailment? But we're mostly just since the, yeah.
Just question, the group that brought up Gulf War syndrome,
yes.
Are there other groups that would have correlating data and agree with that summation? Is that something we should really be looking into? Or, and also, what was the impetus to kind of like make that the framework to go off of for this?
So, Dr. Cullum, I hear you're still on.
Yeah, could you repeat the question? I have trouble hearing it.
So the question for you, and you can correct me, was what was the impetus for, why did you compare, why did you think East Palestine residents could be compared to Gulf War illness?
Right, because in each case there were multiple different chemicals that people were exposed to, including burn chemicals, and it wasn't specific chemical mechanisms of action that turned out to be related most strongly to the illness. It was primarily the shared mechanism that transcends the specific chemical class.